have relatively few patients. This study presents outcomes and complications for a relatively large group of heart patients, 742 patients. Inclusion criteria is consecutive patients over 16 years old underwent primary correction of hallux valgus. This is retrospective study. Total 752 patients underwent post-generation metatarsus surgery between 2020 and 2022. Female is more high patient. We will follow over post-operative 1 year. The most difficult thing for beginner is translating the osteotomy site of distal metatarsal bone to reduce learning curve. I developed translation guide and oscillating RAS. Translation guide has an advantage of being able to quantify movement. I will show you how to use the Estonian RAS in video. This is operation video. It is lateral displacement and first guide wide insertion and screw fixation. And next one, I concentrate to remove the bunion. This is SSG RAS. I use the one-tab incision and like this. The MIS surgery is disadvantage. The medial side is a little bit difficult to remove, so I use this equipment. And lastly, screw fixation in Akin osteotomy. I use the 3.0 millimeter screw. And after that, massive irrigation and dressing. It will take 15 minutes to 20 minutes. Post-operatively, patients were allowed full weight bearing in flat rigid sandal immediately. This is I call it hallux care, toe brace with adjustable tension in the medial side. And I routinely recommend screw removal in 3 or 4 months, but it is not obligation. The study design is retrospective study, and indication is medial eminence discomfort and pain. We check the score and radiologic findings and sesamoid position. We divided the complication grade 1, grade 2, and grade 3. This is surgery cases, severe hallux valgus 46 female. This is the first operative X-ray. Bone union series, this is a pre-operative. This is after 4 months. Mainly I removed this time, and after 8 months, the bone union is well. This is score, the pass and alpha score is much improved, and radiologic finding is much improved. And the post metatarsal length is not changed because I think that it is not closed wedge osteotomy, but open wedge osteotomy. So the metatarsal length is not changed, I think so. Sesamoid position is well performing. Grade 1 complication is no deviation from routine follow. Most common complication is transient neuropraxia, around 10%, but it will be improved after follow. Grade 2 complication is not require additional surgery intervention. This most common grade 2 complication is transfer metatarsalgia, about 5%. Grade 3 complication is require another surgical intervention. It's very small cases, but I checked the prominent bone, and 5 patients has the skull revision. 1 case is post metatarsal joint osteoarthritis. 82% will remove the screw. In summary, PAS and alpha score is improved at 1 year. Radiologic finding is good, and sesamoid position has been improved, especially transverse. It is a transverse osteotomy. The most common complication is transient neuropraxia, transient metatarsalgia, and additional intraoperative fixation. But I think the very low recurrent rate. The strength of our study is overcoming learning curve, acumen, and relatively large cases study compared to other studies. This is a limitation retrospective study and no comparative study and very short-term follow-up. So I will do additional follow-up case study. In conclusion, fourth generation Meta demonstrated significantly improved in clinical outcome. In large cases, we showed a low rate of symptomatic recurrence. Long-term evaluation will be needed. Future study with radiographic and comparative study is required. Thank you for your attention.